Zangpo, good evening and a very warm welcome to BBS. My name is Sonam Wangchuk. In today's program, we will bring you a discussion on the new normal, what public should do to prevent further spread of the coronavirus with the relaxation of lockdown. And if time permits, we will also touch on the reasons for having flu clinics and some of the measures that public should practice while visiting flu clinics. And to discuss on this, I'm joined by Dr. Sonam Wangchuk, Head of Royal Center for Disease Control, and Dr. Tshokey, Clinical Microbiologist from JDWNRH National Referral Hospital. I would like to thank both the panelists for joining on our program. If I may start with Dr. Sonam Wangchuk. Doctor, we have been hearing the term new normal for quite some time. Now, what is this new normal that the Health Ministry is talking about? Is there anything new about the new normal?
Good evening. About the new normal, we have been actually advocating and sensitizing our public even before the outbreak of COVID-19 in Pennsylvania. So the new normal that we are talking about is again nothing new. Yes. Basically, we want people to make a habit, especially the around 6 common preventive measures. First, again, we always wanted people to avoid traveling, to the public places. That means if you have no important works, please stay back at home. That is one. And the other one is again the face mask. This is quite important, and we have been advocating and sensitizing people time and again, even before the outbreak, the importance of wearing face masks, why it is necessary, and even we have provided evidence that how it can prevent the transmission of COVID-19. So this is very important. Just not wearing alone is not enough. You should also know how to wear and how to discard, and also how to change the face masks that you are wearing. The other one is social distancing. Again, this is another very critical and important. So if you are visiting any public places, please make sure that you keep social distancing at least 1 meter away. That is very important, because we know the mode of transmission and the droplets of the people, infected people, how long it can go when people, he or she is sneezing and coughing. The other one that which especially in Bhutan we have been advocating, sensitizing the new norm is about the Doctor's app. Because if there is an outbreak, so it's very important that we trace the primary context within that given risk period. So if the people are not following that, then that's why we take a lot of time to do the contact tracing, and that's why then it delays the action at the field. So therefore, still once again, please make sure that trace app please use wherever you visit the public places, because now I think it is everywhere, even the vehicles, public transport you travel, it is there. So only thing is now you have to make habit. You have to keep in mind. The other one is now again hand washing. I cannot emphasize more on hand washing. Please, as frequently as, please make sure that you wash the hand. Even if you go to the public place, I think we've now, after the 6 months of the COVID pandemic, we have seen now a lot of public places that the hand washing facilities there. But if you don't make use of it, then again it makes no sense of investing a lot of infrastructure, especially the hand washing facilities at the public places. Then other one is we have been advocating, if you are feeling sick, fever, coughing, please do not go to the public places. And even if you are visited or in a place where you have been working and suddenly you feel sick or coughing and sneezing, please follow the proper cough etiquette. So these are the 6 common, actually, the new norm that we are talking about, which actually we have been advocating for last 5-6 months. That is the only the preventive measures that can prevent us the similar lockdown. So just now I think the current lockdown was nationwide lockdown, but again this was inevitable because we couldn't really comprehend before how the spread could be, especially within a given short time. Our people are so mobile, so people travel very fast across all the districts. So that's why I think we have to be very mindful that the travel restriction is now become one of the most, I would say, the important component to really look into, because if people are not traveling a lot, then this is going to be very critical, and this would really spread widely. So that's why these are the 6 common norms that we have been advocating, and still we will still go for this 6 norms. Basically, I think this is something that every individual should make a habit. That's it. Beyond that, there's nothing else we are asking for. Just make it a habit, practice it. I know it is not that easy because we have never used to such normal practices, and Buddhist people are socializing because of culture. So now I think you have to keep in mind that we cannot go as business as usual. Yes. So again, we would like to reemphasize those 6 common preventive measures to be followed strictly by every individuals wherever you go. Even if we stay in the home, please make sure that you have the minimum preventive measures followed.
Nice. Dr. Sonam, thank you so much for elaborating on the new normal. Now if I may bring in Dr. Tshokey. Doctor, now with the easing and relaxing of lockdown, does that mean Bhutan is free of free from COVID-19?
Good evening to everyone listening to this live program. As we opened up, as we have been focusing on our all precaution measures, still we have to keep in mind that Bhutan is not free of COVID yet, and for that matter, no country is free of COVID as of now. Everybody, every people, every citizens of the different nations are at different levels, different risks, and different preventive mode. But we in Bhutan, although the number of cases seem to have spiked in the last few days, we haven't now started. We have started opening up from the 1st of September, day before yesterday. That is based on the epidemiological evolution, the changes in the disease pattern. That even if we had the few spikes in the last few days, cases have been now coming down. These few since yesterday we didn't have any case, and all the contact tracing testing in high risk areas, like especially now Phinsiling, have been completed. But that doesn't mean that we are free of COVID. We just have managed this first local outbreak successfully. And I would like to stress that from day before yesterday, I think the government allowed people to come out, walk around in their zones. But that doesn't mean that we are free. You can do whatever you want. The permission to come out of their home is under a very strict, very regulated manner, by keeping physical distance, by wearing masks, not really come out in crowds. So all these things have to continue. All these have to continue, and there have been a lot of advisories, a lot of press release from the Prime Minister's office, from the Ministry of Health. Every individual, every Bhutanese should take this notices, take this information very seriously. Not really go out and say, don't go out with the I don't care mode, because the virus is still around. And as long as it is in the world, Bhutan is not free. And especially in the high risk areas, in the southern districts, I really think that we have to be more vigilant, more strict now with the beginning of this new normal. Not relax and just do what you want. And then from tomorrow, people will be allowed to travel in public transport. Then there is always a risk that people had to comprehend and take appropriate measures. So it just means that we will adopt this new normal, but with much care and much responsibility, individual responsibility. It doesn't mean that we are free of COVID.
Dr. Sonam, we all know that for 21 days the country was under lockdown. How did the lockdown help curb the infection, or for that matter, or the transmission in the country?
Lockdown, actually, I mean, because we are not the first country who's undergone lockdown. I think right from the pandemic started in China, I think you all know they have under lockdown, I think more than 20 days, I think beyond that also. So in Bhutan, nation, our lockdown was 21 days. So basically I think that lockdown, what people have to understand is basically we are assuming that when there is an outbreak, a lot of people have moved and they went back from the possible place where they have exposed. So then if people can stay back at their home, So we think that in that home itself, the virus, the cycle of virus complete, because they will suffer, and of course in home, I mean their family may get, but in that virus does not go spread beyond that house. So this whole idea of lockdown, because basically we want to break the transmission at the house level, so that there is no transmission in the public places. So although the lockdown, I mean economically, even social point of view, lockdown is very expensive, but then that is the most effective, and this has been shown in various countries who have done lockdown very well, and people have followed it properly. So it has shown very effective. And of course the country depending on the country, the scale of outbreak, the lockdown duration differs. But in our context, since we had the outbreak for the first time, and then knowing from the lot of primary context travel across the district, so we thought that the duration should at least be 21 days, so that there is so that we can stop that change of transmission. So that's why the lockdown has happened for 21 days, and with 21 days lockdown happened successfully. Of course, there are a few instances. So we are hopeful that at the moment that active change of transmission has been interrupted.
Yes. Thank you, Doctor. Dr. Tshokey, completing successfully 21 days under lockdown, and now with the relaxation of lockdown, can we safely say that there is no more local transmission in the country?
Yeah, thank you. So with the first local transmission and the lockdown, most cases concentrated in Phinsiling, and few cases with the primary contacts of the patients in Phinsiling, in Ha, in Paro, and in Thimphu. We have really scanned, we have really tested people in Phinsiling, almost the whole population. Over 25,000 samples were tested, and still every day we continue to sample different groups of people in Phinsiling and continue to test them. And we have tested over 2,000, almost 3,000 samples from Ha, where areas in the high risk zone where primary contacts have tested positive. And also we have tested a lot of samples from Paro, where the cases were detected. And of course Thimphu, a lot of testing has happened in the cases where primary contacts have detected. And we also extended our scanning and contact tracing testing into Gelefu. A lot of samples have been tested. And similarly, because there have been some highlighted risks in Samrujongkha and the Tashigang highway, we tested a lot of samples from that group also. So far, we have not detected any from that Tashigang Samrujongkha highway. That is quite encouraging. And then Gelefu, we haven't had any cases except the primary one case index. We have after that a lot of cases, including hospital staff. A lot of contacts were tested, but nobody has come positive. And of course, in Ha, no cases detected out of the primary contacts and the cases. And Paro as well, no cases detected from outside. And then Thimphu is very much restricted to just one case that has the primary contact from the Phinsiling case. And of course, Phinsiling also a few positives in the last few testings, but the number of cases detected every day has been going down. And fortunately, yesterday we haven't had any case from Phinsiling cluster, the testing. Of course, we don't know what will happen because every day we are testing both in Phinsiling and also in Thimphu. So I wouldn't say that we have really controlled everything, but I wouldn't say that we haven't really done much, but we have really scanned every risk community related to the primary check, and then I would say that we have managed to control the current outbreak. But people should not take this as a relaxation, this as a excuse that we have now no local transmission, no cases in around the localities, no cases in different districts. So the main idea is people should not go into the relaxed mode. We have managed to control this present outbreak, but in the future similar outbreaks can happen anytime, anywhere.
Yes, Doctor, now that Dr. Tshokey, now that the lockdown is open, now what should people do to prevent further transmission?
What we have to learn from this lockdown is that this is the first lockdown. It was done to curb the local transmission, because the main basic idea of a lockdown is to restrict people coming out of their home, so that if somebody is infected, we catch him early from the house, and the virus is very much restricted to that household or that individual.
Yes.
And the person who are infected do not mix with other people in the community, so that there's no widespread. And most of the time lockdowns happen for a duration of as long as the epidemic is controlled, yes, depending on the incubation period and all those, so that the infection dies in one individual or in one household.
Yes.
And now that we have come to the end of this lockdown and we slowly open up, there have been questions that why a lockdown was announced abrupt, ad hoc, and then people were not prepared, whether future lockdowns will happen in a similar manner, whether there will be a lockdown at all in the future. So I would like to make it clear that lockdowns are bound to happen.
Yes.
Especially if we don't be very careful about the health advisories that we are giving, like physical distancing, hand washing, and wearing of face masks, and not traveling without, if people continue to travel without any, just freely between districts, not following public health measures, we will have to, we will again land up having a lot of lockdowns, not only once. And then from learning from this lockdown, people have to stock up, because a lockdown, we, as far as I'm concerned, we will not have a planned lockdown. Yes. We will not make prior announcements that we are going to lock down on September 10th or September 15th. There will not be something like that. Such planned lockdowns happen in countries where the outbreak is beyond control. Yes. Lot of cases happening every day. So when the cases go beyond control, they want to lock down because to control the number of cases. At least up to a certain extent.
Yes.
So in Bhutan, so far, the transmission is under control, and we, as long as we take the very strict measures and quick attention given to any cases detected from anywhere, we will not have the problem of having mass outbreak. I wish that would be possible. And then from henceforth, in preparation for a future lockdown, it can happen anytime. That's why I would suggest people, I would advise people to at least keep stocks, keep essential stocks for at least 1 week, minimum 1 week, if possible 2 weeks, or even up to a month.
Yes.
Of course, it is very difficult with green vegetables and all those, but at least to every time people should have stocks in to last for a week.
Yes.
So that lockdown happens tomorrow, you are prepared.
Yes.
And then the one of the most difficult situation that we had with the current lockdown is people stranded on the road.
Yes.
And it would help if people avoid traveling unnecessarily.
Yes.
Unless there is genuine reason, there is emergency medical conditions, don't travel.
Yes.
Between just don't travel freely until there is some vaccine or the pandemic is controlled. People should avoid traveling freely between districts.
So basically you are trying to say that lockdown can happen anytime.
Yes. Yes.
Yes. Thank you, doctor. We still have around 10 minutes more. Let's touch on flu clinic. Let me bring in Dr. Sonam Wangchuk. The ministry has set up flu clinics in some of the locations. Why do you think flu clinics are? Do you think the flu clinics are necessary?
With COVID, since it is a respiratory illness disease,
Yes.
and more of transmission is through the droplets and through the close contacts, and in hospital facilities, if we start having the same the OPD, that is flu services that if you provide, then there is high chance of people are mixing unknowingly. I mean, some people may not know also that actually they are actually suffering from the COVID. Maybe they must be visiting for some other health diseases. Yes. So that's why that is a higher risk of the outbreak transmission, yes. As well as then hospital being the place where we manage, and a lot of people who visit are not normal person. Yes. Usually they are ill, sickness, yes. immunocompromised. So that's why I think if we have transmission in hospital, I think we are likely to see a lot of cases, yes. And then maybe even the mortality, because if the infection goes inside the ward, where there is a lot of admission. So because of that, I think segregations of respiratory illness should be the outside from the main hospital. So this is one of our containment or preventive measures. So that the people who are actually suffering from respiratory illness, flu-like illness, or now we call COVID-like illness, because a lot of people know what is the COVID-like symptom. So if they can be channelized, or there is a separate place, then we don't mix with other people that visits hospital for other purposes. So this way actually is sort of again the preventive, one of the preventive strategies that we are talking about, because people will suffer from flu-like illness, and we are now advocating people to visit the flu clinic if they are suffering from any illness. So in that way, I think risk is more for those people, if they visit the hospital to transmitting to other people. So this way we wanted to cater the separate location. So initially I think our flu clinics was near the hospital, but now we found that I think that is not safe enough, and there is always possibility of people mixing I think nearby with the people visiting for other purposes, as I said. So therefore we are now re-strategizing, I would say. That means little bit take the flu clinic away from the hospital center if possible, so that there is no sort of mixing or completely separated that people suffering from the flu visiting the flu clinic. So because these are the highly, I would say, the suspect case, likely who may be actually the COVID cases, because now with the community transmission has already happened, and we don't know, because there could be still people suddenly shedding the virus. So because just now we are talking penicillin, but again just now after the lockdown we think that now the active transmission is no more there, but again with especially at the risk given at the southern side. So I think any point of time, it's a matter of time. One person has to come with the symptoms, then again the outbreak will be happening. So because of that, I think the flu clinic we have kept it separately, and now I think henceforth again one of the new norms is now we are really advocating people to don't stay back. Please visit the health facility, especially the flu clinic, so that we test you and we detect you. So that if you detect, then we catch you early, and then we can then trace, treat, and quarantine all the contacts of the individuals.
Thank you, Dr. Tshokey. While talking about test and detection, are COVID-19 tests done in the flu clinics only, or is it done somewhere else?
So as on the flu clinic, we are slowly advocating people to visit flu clinics with those, especially those who are having signs and symptoms of COVID-like symptoms, and then in the long run, we want to equip this flu clinics with the basic medications, and also we set it up so that flu clinic can do tests for COVID on the spot, especially to get rapid results, and then because we have test kits where we can get results in half an hour. So this kind of kits are set up in the flu clinic where people can avail the service. But any cases that we have strong suspicion, or any cases that show positive in those rapid kits, we will confirm it with the RT-PCR, the gold standard. And even those flu clinics, we are also planning, like in the testing of last time we had bad experience of visiting homes and calling everybody out. Those people who had visited penicillin, we were making home visits, and it was really difficult to even test a few people in hours time. So in the long run, if we have to test a local community, like in Thimphu, if we have to test people on large scale, we will be using those flu clinics as a testing center. We will call people from the super zones and the zones to those flu clinics that we are going to set up within Thimphu zones. So that flu clinic will also be used as a testing center for COVID, and also in the long run, in the future after COVID, we may use it as other diagnostic centers for sample collection centers for infectious diseases like tuberculosis and all those. So in the long run, this flu clinic will serve a very good purpose of preventing people with infectious diseases that are spread through by cough and sneezing, like TB, COVID, and all those will be segregated from the mainstream hospital. So people coming with other diseases like hypertension, diabetes, cancer, they come to the normal hospital are not at risk of getting infections because they visit the hospital.
Yes. Dr. Sonam, what are some of the preventive measures that people should follow or practice while visiting the flu clinics?
Again, basically the same new normal we are talking about. So when you visit the flu clinic, again the cough at your face mask is required, and of course if you are coughing, then please practice the cough etiquette. I mean, even though you may be wearing a face mask, but still I think it's good to practice the proper cough etiquette. Then of course when you visit the flu clinic, of course, there will be somebody to guide, especially keeping the physical distance, because that's very important, because this is the people where is the people visiting with possible infection of a COVID. So I think because of the high risks, that we assume that these people are visiting because of the respiratory illness. So physical distancing is most important, and then of course the moment you are there, and then there will be a quick sort of investigation, and then now what we are advocating is the mandatory testing for COVID.
Yes.
Of course, the people visiting flu illness may not necessarily be suffering from the COVID, but there are other diseases like influenza, because which is quite common now. I think we are forgetting the influenza because of COVID, because otherwise around this time it is the influenza season.
Yes.
So although I mean the influenza season is around, but because of the COVID intervention, I think it's equally helping the influenza outbreak and influenza illness.
Yes.
I think it has drastically gone down through our surveillance. So actually, the flu clinics, opening flu clinics separately and following all the interventions, new norm we are talking about, by every individuals with own responsibilities. I think not only COVID, it will minimize the transmissions of cases, but even the other, especially the Dr. Tshokey was mentioning, the tuberculosis, which is still a big concern for us. Then the influenza, which is another the virus that we cannot predict when the outbreak will happen. Yes. So it has a multi I think advantage for having a separate flu clinic. And then of course, when you visit it, please make sure you assume that you are visiting high risk area.
Yes.
So every individual should keep in that mind, and all the preventive measures that we are advocating has to be kept in mind and follow stringently, especially when you visit the flu clinic.
Yes. My final question to Dr. Tshokey, in case if you have data on this, how many people have visited flu clinic so far?
Actually, flu clinic visits every time there is a case, or every time there is some outbreak, we have a lot of people visiting the flu clinics, and especially a little bit of history. When the time the first case of COVID was detected, flu clinics were flooded with people.
Yes.
And then the number gradually dropped, and of course recently because of the lockdown, many people really couldn't come out freely.
Yes.
But we have catered to people who really need the service by visiting them and then attending to them by personally calling. So I actually do not have an exact figure as of now, but we encourage people to visit flu clinics. Yes. So with the opening from the 1st of September, so and then now with the more stress given to flu clinics being outside the hospital, and more testing facilities available, I think we foresee that flu clinics will serve a very important purpose. And then people with flu symptoms need not come to the hospital, and then each case, each hospital, each district will have their own flu clinics to cater to all these people, and which will serve also as a COVID testing center. And then with the opening up, we see that now more and more people will come to the flu clinics.
Visit flu clinics in case if you show signs and symptoms of COVID-19. Follow new normal, that is wash your hands, use DRUGAPs, keep physical distance among others. And with this note, I would like to thank both our guests, Dr. Sonam Wangchuk and Dr. Tshokey, for being on our show despite your busy schedule. Thank you once again for being on our show. Thank you for watching the program, and it's good night from me.